The member from Barrie.
Mr. Speaker, my question is for the Minister of Health and Long-Term Care. Yesterday, our government introduced a budget which includes significant investments in health care. In fact, the 2018 budget increases the health care spending by 5% to reduce wait times, provide access to care, and enhance the patient experience. Most importantly, this budget includes funding for priority health care services that will have a real impact on Ontario families. Sure. Mr. Speaker, this budget invests in our hospitals, in mental health, in our long-term care homes, in home care, in our world-class health care professionals. Right. Mr. Speaker, we know that the people of Ontario want to age in their communities in the comforts of their homes. I myself have told my children I intend to be home until Steckley's funeral home comes to get me. Can the Minister of Health and Long-Term Care please inform this House of the investments our government is making in home and community care?
Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker, and of course thank you to the member from Barrie for giving me the opportunity to discuss our government's plan to provide more care at home and in the community. As our population ages, our government has made it a priority to improve home and community care so that patients can receive care in settings that are as comfortable and convenient for them as possible. And that's why we're investing $230 million in home and community care. And that means that there will be 2.8 million more hours of personal support, the equivalent of 1,400 full-time positions, 284,000 more nursing visits, and 58,000 more therapy visits. We're also providing $175 million to create 20 new hospices within 3 years. I want to thank my parliamentary assistants for that initiative. Speaker, these investments will keep people out of hospital and help more people get the care they need at or close to home and in the community. Thank you, Mr. Speaker.
Supplementary.
Thank you, Minister, for that response, and thank you to the Minister and the Premier for all their hard work and dedication ensuring access to high-quality care across the health sector. Mr. Speaker, we all know how valuable our skilled, compassionate healthcare workers are. Our 2018 budget would provide an additional $822 million for hospitals to ensure that they have the resources to continue doing an incredible job of caring for our loved ones. It also provides $300 million over 3 years to increase staffing in long-term care homes. That means every long-term care home in the province will benefit from an additional registered nurse on staff. Mr. Speaker, we also heard yesterday that our government is investing in one of the largest groups in our health workforce, personal support workers. Speaker, can the Minister of Health and Long-Term Care please share with this House what our budget is proposing to support PSWs?
Minister of Health.
Well, thank you again to the member for that question. And I know the third party is particularly interested in this topic, as they asked a question on this topic yesterday. We do know that how critical PSWs are to the health and well-being of Ontarians. And as the population ages and more medically complex clients require care, the role of PSWs in our healthcare system will continue to be critical. And that is why, over the next 3 years, we will invest $23 million to add 5,500 PSWs to the workforce in underserviced communities, a $38 million training and education fund for new and existing PSWs will ensure that they have the tools they require to support our loved ones, and a $65 million investment over 3 years in retirement security for PSWs. It's so vital that we recognize and support PSWs as trusted and valued members of the healthcare team, and we're committed to supporting them to provide quality care to our most vulnerable Ontarians wherever they may live. Thank you, Mr.